Hi, I'm Jessica Peacock, Chief Recovery Officer at PeerStar, and this is a quick introduction into peer support within a nursing facility. I'll give you a very quick glimpse of what peer support is and what it looks like within nursing facilities. For those of you that are not aware, peer support is simply a home and community-based mental health recovery service. It is provided by certified peer specialists, individuals who have lived experience of having their own mental health struggle, who have learned to live well with it, and who have gone through a certification training process to be able to guide and mentor others. It's a non traditional mental health recovery support service. It is not to be confused with mental health treatment. In this service, certified peer specialists inspire hope that recovery is real. They provide encouragement to people as they work towards recovery goals. They help guide that mental health recovery journey, and they model and teach wellness strategies. Again, from the perspective of lived experience, as well as additional training. More specifically, peer support specialists support people in developing and implementing their very own individualized recovery plans based on their own strengths and needs. These plans can help somebody plan for and even manage a mental health crisis. It can help them build community and natural support systems. It can support the person in learning to advocate for themselves, as well as promote personal responsibility and empowerment. These plans often provide opportunities for people to develop self help, self improvement, and self worth strategies. They also guide and implement strategies for improved overall wellness and life satisfaction. And lastly, a great part of peer support is helping people improve their social networking and their overall connections. So, who is eligible for peer support services? In the state of Pennsylvania, adults who are 18 and over, who are Medicaid eligible, and who have a mental health diagnosis with a functional impairment qualify for peer support services. We do like to point out that the individual must be able to cognitively engage and actively participate in behavioral health services. Because as we just mentioned, these services include developing plans and working through steps towards goals. Now, in addition to being 18, Medicaid eligible, and having a mental health diagnosis with functional impairment, we have some special populations that may be living within a nursing facility that our staff have received additional training to support. So, in addition to someone who has a general mental health struggle with functional impairment, we can also provide specialized support to the aging population in something that we call empowered aging peer support, which is for individuals over 65 who also have a mental health diagnosis with functional impairment. We have dual diagnosis peer support, where our staff have been trained to work with somebody with both a mental health diagnosis as well as some type of developmental distinction or disability. We have a special forensic peer support program where our staff may have their own lived experience of being within the criminal justice system, or they may not. But either way, they receive additional training to support someone with a mental health diagnosis and involvement within the criminal justice system. And lastly, we also have a specialized training and program for co-occurring peer support, which is individuals who have both a mental health diagnosis and are experiencing a substance use disorder. Now, as I mentioned, we can provide peer support services to anyone over 18 who's Medicaid eligible with a mental health diagnosis with functional impairment. These are just some special populations that our staff receive additional training to help guide, mentor, and support. So in the community, peer support empowers and encourages hope, like I already mentioned. It connects individuals to community resources, where they live. What are the opportunities for them within their own personal community? It builds personal connections and relationships. That can be with family, that can be with neighbors, that can be with other people in their community at support centers at other community organizations. Peer support models and teaches coping skills and wellness tools, which is something we've already mentioned. And it supports the individual in monitoring and managing the other treatment they receive for both their mental and physical health and wellness. Now, in a nursing facility, peer support is the exact same thing. It's just within that person's living arrangements in the nursing facility. They are still working on all the same things they do in the community, only they work with the facility staff before services begin to collaborate on the available resources within that facility. PeerStar will collaborate with the facility to find out what activities and resources are available for that individual at the facility. What opportunities to socialize are available, both within the facility and outside of the facility, that we can help connect the individual to and how we can help them become involved in. And lastly, we'll collaborate with the facility to find out what are the facility's schedules, what are their roles, and what are the processes that our staff must know and that the resident must know for it to be an effective collaboration. That's really it. As I mentioned, it's a very simple snapshot. It is a collaborative partnership between PeerStar and the nursing facility that we are coming into. We hope to have an opportunity to meet with facility directors, social workers, administrators, anyone who may be interested in referring individuals who meet the eligibility criteria and who would benefit from having a certified peer specialist. If you have additional questions, you can contact me. My information is right here. And if needed, I can get you in touch with the regional director for your geographical area. We look forward to hearing from you.